Welcome all to the mock test and its answer explanation session. We have already uploaded many mock tests and now we will go for its answers rationally and some important memory tips. Let's go. The first question is, which is the earliest sign of rickets? Option A, Harrison's groove. Option B, craniotabs. Option C, Bowlegs. Option D, ricket rosary. So the right option here is option D, craniotabs. Rickets is a bone disease that causes soft, weak bones in children. It is usually caused by the vitamin D deficiency, which will result in reduced absorption of calcium and phosphorus. Rickets is in children by vitamin D deficiency, and in adult, the vitamin D deficiency will cause osteomalacia. Craniotabs is a condition in which the skull bones of an infant or child soften or thin. So the memory tip here is cranio earlier soften. The earlier sign for rickets is softening of the skull, that is craniotabs. The other clinical features includes delayed claustrophontobonal, fundal bruising, dental hypoplasia, pectus carinatum, that is the breastbone protrusion and ribs protrusion, swelling in wrist and ankle joints, wide sutures, craniotabs, which is already seen the earlier symptom, the skull softens, rochatic rosary, Harrison's groove and bowing of legs. Next question. What is the renal threshold value of glucose? Option A, 182 mg per dl. Option B, 188 mg per dl. Option C, 185 mg per dl. And option D, 180 mg per dl. The right answer here is option D, 180 mg per dl. So the renal threshold value for the glucose is 180 mg per dl. Next question. A patient with spinal cord injury says, I have no control over my situation. I can't do anything for myself. This patient is exhibiting option A, asociality. Option B, acceptance. Option C, denial. Option D, resignation. The right answer here is option D, resignation. Resignation is involving the surrendering to obstacles and settling for what happens, even if it is detrimental. It means giving up on changing things. So here the patient is saying that I have no control over my situation. I can't do anything for myself. So this is kind of surrendering to the obstacle and settling of what happens. So this is resignation. Let us see the other terms. Denial. Denial means unwilling to accept the truth about the situation. They will strongly try to refuse or resist the situation. That is denial. Asociality is a total lack of motivation to engage in social activity, and acceptance is the final stage, accepting the situation as it is. So we can remember the DAPTA, the grievance for the cancer stage, like denial, anger, bargaining, depression and acceptance. So last stage is the acceptance. Here the answer is resignation. Next question. How many drops per minute would you administer when the doctor's order states that the client should receive 1000 cc of fluid for 8 hours and the IV set deliver 20 Gz per cc? Option A, 48 Gz. Option B, 51 Gz. Option C, 42 Gz. And option D, 31 Gz. The right answer is option C, 42 Gz. Here we see the calculation. 1 ml is 20 Gz, so 20 drops. 1000 ml in 8 hours means flow rate will be 1000 divided by 8, that is 125 ml per hour. 125 ml per hour we will convert into Gz or drops per minute. So here 125 into 20 is the drop factor. Here 60 it is hour to minute. So ml per hour to drop per minute. So here 125 by 3, that is 41.66, which is approximately 42. That is the answer in the given option. So 42 is the answer. Next question. Which AV block is also referred to as Moffitt's type 2? Option A, complete head block. Option B, second degree AV block. Option C, third degree AV block. Option D, first degree AV block. Here the right answer is option B, second degree AV block. Let us see about the blocks. First degree AV blocks is shown here. That is the prolonged PR interval. The PR interval is prolonged in all the areas. Then the second degree, there is type 1 and type 2. Type 1 block, you can see here there is a specific pattern. PR interval is keep on prolonging and then one missed beat. Again here it is keep on increasing and then one missed beat. But in Mobis type 2, the PR interval will be fixed in everywhere, but multiple P waves are without QRS complex. That is type 2. Then type 3 or complete heart block is there is no relation between P wave or R wave. So that is the complete heart block or third degree heart block. The memory tip for this one is about a husband-wife story. About the late coming. I will be explaining this in the ACLS quiz session, but here I will briefly tell you. This prolonged means, see, once the couple is married, for the beginning days, the husband will come regularly on time. That is the normal sinus rhythm. Here, in first degree AV block, it is just like husband is coming every day late. He is coming every day, but he is coming late every day. So that is first degree. This is the start of block, first degree AV block. Second degree type 1, husband is one day he will come early, but next day he will come little late. Other day he will come more late. Then one day he will not come. Here he will not come. Again, to compensate this, one day he will come early, another day he will come little late. Again he will come more late, then he will not come. So this kind of pattern is repeating in second degree type 1. So the block is keep on increasing. Then in second degree type 2 or Mobis type 2, whenever the husband comes, he will come on time. But he will come multiple times, he will not come. Like multiple times there is no QRS complex. So multiple times he is missing from the house. So that is more block, second degree type 2. And in complete block, when the relation is completely blocked, there is no relation between QRS complex and P wave. So wife will come by her own wish and husband will come his own timing. So that is complete block. Next question. Incubation period of an infection is in which? Option A, person is most infectious. Option B, organism growing and multiplying. Option C, recovery from infection. Option D, presence of specific signs or symptoms. The right option is organism is growing and multiplying. You can see the explanation. Incubation period is the span of time between exposure to an infectious disease and the start of symptoms. This period, no signs and symptoms is there. So in incubation period, there will be no signs and symptoms. Prodromal stage is the stage where the person is most infectious and with signs and symptoms. Convalescent period is the recovery period from infection. Next question. Which is a chronic inflammatory and autoimmune disease affecting peripheral synovial joints of bone? Option A, rheumatoid. Option B, polyarthritis. Option C, osteoarthritis. And option D, ankylosing. The right answer here is rheumatoid. Here you can see the explanation. Rheumatoid arthritis is a long-term autoimmune disease that causes inflammation of the joints. Polyarthritis will include minimum 5 joints. Osteoarthritis, where the cartilage will be broken down. This is the most common arthritis. Ankylosing means the joint fuse together and become stiff. Next question. A patient has elevated prothrombin time Which medication should the nurse consider as possible cause of elevated PT? Option A, rifampin. Option B, vitamin K. Option C, birth control pills. And option D, phenytoin. The right answer here is option C, birth control pills. Here, elevated prothrombin time can be caused by taking certain medications including warfarin. You know this is already given purposefully to thin the blood and increase PT. Amiodarone, a medication that can increase the PT when added to warfarin. Amiodarone is an antiarrhythmic drug, but in other side it can increase the PT as well. Antibiotics, some antibiotics can increase PT, especially after surgery in older patients. And here the answer, estrogen containing medications, birth control pills and hormone replacement therapy can increase PT. So here the right answer is birth control pills. Vitamin K and all will act in the opposite direction, right? Next question, which structure acts as wires of a telephone in the body? Muscles, nerves, arteries and veins. This is a simple question. I think all of you already know the answer. The answer is nerves. Nerves will act as wires that will connect from brain to all parts of the body through nerves. The nurse is assessing a patient with breathing difficulty and the patient is anemic. The nurse should look for which parameter in CBC? Option A, leukocytes. Option B, platelets. Option C, thrombocytes. Option D, erythrocytes. Here, patient is in breathing difficulty and anemic. So, patient is having which parameter deficiency? You can see the answer, erythrocyte. Because erythrocytes will have hemoglobin which is responsible for oxygen carrying. Then erythrocytes, also known as red blood cells, contain hemoglobin and iron-rich protein that carries oxygen in the blood. So that is the right answer. Next question. The establishment of personal relationship and affection takes place in which stage of group dynamics is termed as performing, forming, norming, storming? So in which stage of group dynamics the establishment of personal relationship and affection takes place? The right answer is norming. Here you can see the stages of team development Tuckman model. It is forming, storming, norming and performing. Forming is learning about each other. Storming is challenging each other. Norming is working with each other. Performing is the final stage, working as a one unit. So in storming stage they will oppose or challenge each other, and in norming they will work each other. So the right answer is B. A child is treated for first degree burns to thigh. The child is not eating and in discomfort. The highest nursing priority here is option A, altered nutrition. Option B, impaired skin integrity. Option C, risk for infection. Option D, acute pain. Here the answer is option D, acute pain. Here we will see the guidelines and priorities. ABC always first. Here no ABC issues. Life-threatening conditions like uncontrolled bleeding is not there here. Hazardous environment or scene safety issues are not here. Severe pain is here because the pain is causing the child to not eat properly. So you have to address that, the discomfort and is not eating and crying. So that is due to the pain due to the burn, because this is a first degree burn only. So mainly the pain management can solve the issue. So the highest priority here will be to address the acute pain. Then other than that, risk for infection, impaired skin integrity, altered nutrition, all those things will be coming. But First, we have to address the pain, that is the priority. That is the right answer. Next question. HML analysis means heaping, molding, and lowering estimate. B. High, medium, and low estimate. C. Hierarchy, moderate, and low estimate. D. High medical laboratory inventory. HML analysis is one of the main tool in inventory management, and the right answer is high, medium, low estimate. HML is high, medium, low inventory management. HML analysis or high, medium, low analysis is a method for categorizing inventory item based on their unit price. It is used to help with inventory management and control. Next question. A conscious victim of a car accident is arriving in ED. The patient is tachypneic and anxious and in distress. Deviated trachea is present. The probable diagnosis should be option A, pleural effusion, option B, hemothorax, option C, cardiac tamponade, option D, tension pneumothorax. The right answer here is option D, tension pneumothorax. Tracheal deviation is related to tension pneumothorax. T and T is highlighted as a memory tip. Tracheal deviation most commonly occur due to the increased pressure in the chest. This can result from tension pneumothorax. You can see the deviated trachea here and tension pneumothorax, the appearance, commonly known as collapsed lung. Next question. Osmotic pressure and acid-base balance of the body fluids are maintained by option A, sodium, option B, magnesium, option C, fluoride, option D, zinc. This is also a simple question. I think all of you already know the answer. The right answer here is sodium. In human body, osmotic pressure is primarily maintained by the concentration of sodium ions in extracellular fluid. Sodium plays a crucial role in regulating the movement of water across cell membranes and maintaining fluid balance throughout the body. Next question. The nurse is caring for a hospitalized diabetic patient for advanced recovery. Which of the following is most important? A. Moisturizing skin with lotion each day. B. Ensuring that foods are not too hot. C. Facing the patient when speaking. D. Assessing the heels for breakdown. Here also you have to see the priority. The right answer here will be assessing the heel for breakdown. Here in diabetic, the risk assessment, you can see risk assessment and its priorities. In that previous question about risk assessment, in the burns, especially the first degree burns, the main issue was the pain. Because of that, the child was not eating. Here in diabetic patient, in elderly persons, the risk of food ulcers is high because it can lead to complications like diabetic food. So food ulcers will be the priority here. We have to assess for food ulcers, and if it is there, you have to do the interventions like this. But the first thing is to assess the heel for breakdown to prevent the food ulcers. Next question. The number of new cases occurring in a defined population during a specific period of time is option A, morbidity, option B, prevalence, option C, incidence, option D, point prevalence. The right answer here is incidence. You can see incidence is the measure of how many new cases of a disease occur in a population over a set period of time. So this is the new cases of disease. New cases, that is a highlight. Prevalence include all cases, which will be both new and pre-existing cases. And morbidity, mortality already you know. So here the answer is incidence. Next question is, which drug is used to treat HIV or AIDS? Option A, ampicillin, option B, dexamethasone, option C, streptomycin, and option D, zidovudine. Here the answer will be option D, zidovudine. Here for HIV treatment, there is antiretroviral treatment regimen with zidovudine. This will be used to treat HIV in adults and children. Next question. Which theory was developed by a nurse? Option A. Uncertainty in illness theory. Option B. Hierarchy of need theory. Option C. Social cognitive theory. And option D. Job satisfaction theory. The right answer here is option A. Uncertainty in illness theory. Here you can see Michelle Emmett, a nursing theorist who created this concept. The uncertainty in illness theory is developed by a nurse theorist named Michelle Emmett. The other theories like Maslow's hierarchy of needs theory is done by the Maslow, who is a psychologist, and social cognitive theory is done by Albert Bandura. He is also a psychologist. Job satisfaction theory is a collection of many theories that explain what make employees satisfied with their job. So the right answer here is uncertainty in illness theory is developed by a nurse. Next question. Where does the fertilization take place? Option A, infundibulum. Option B, ovary. Option C, ampulla. Option D, isthmus. Here the right answer is ampulla. You can see the fertilization mainly occur in ampulla. So the answer is ampulla. Next question. How much population is covered by a community health center? CHC. Option A, 15,000 to 45,000. Option B, 20,000 to 30,000. Option C, 3,000 to 5,000. Option D, 80,000 to 1,20,000. Here the right answer is option D, 80,000 to 1,20,000. Here you can see the table about subcenter, PHC and CHC. CHC cover 80,000 to 100, that is 1,20,000 population. Here you can see plain area and hilly area, like that it is divided. Subcenter, it is 3,000 to 5,000. Primary health center or PHC is with 20,000 to 30,000. Community health center or CHC is with 80,000 to 1,20,000. Okay. Next question. In domestic water sewage, which of the following thing is not a part of dissolved material? Option A, nitrate. Option B, phosphate. Option C, calcium. Option D, sand. These kind of questions are very easy questions and you can easily score it if you show the patience or if you didn't jump into conclusion. So here the answer is sand. You can see sand is not a dissolved material. That itself will give the answer, and by elimination method you can use it like that. And other method is we can see what are the solvents which is called TDS, total dissolved solvents in water. This will include calcium, magnesium, potassium, sodium. These all are the positive. Then carbonate, nitrate, bicarbonates, chlorides and sulfates. So these all are the TDS, total dissolved content. So if you know this, you can easily answer the question. Like you can exclude this and choose the option sand. Even if you don't know this, with common sense you can identify sand is not a dissolved material. It will just stay as it is. So sand will be the answer. So either way you can answer this question. This sort of questions are like luck factor for you. Next question. The most appropriate diet for a client with COPD is option A, low fat, low cholesterol. Option B, bland soft diet. Option C, low sodium diet. Option D, high calorie, high protein diet. This is a tricky question. It is from nutrition and diet. Here the right answer is high calorie, high protein diet. Why? Because the COPD patient should eat enough protein, fiber and healthy fat and drinking plenty of fluid. There is no restriction. Like CKD and all, there will be restriction of salt, fluid, etc. But here no restrictions. It also involves choosing foods that are easy to digest and avoid fried foods. Only for the fried food and some other kind of unhealthy food, there is restriction. I will show you the table. You can eat proteins, fruit and vegetables, whole grains, good fat, fluid, etc., and avoid high sodium food, gas producing food, and excessive sugar and refined carbohydrate. Next question. Which is the most suitable position for giving an enema? A. Right lateral, B. lithotomy position, C. prone position, D. left lateral position. I think all of you know this. The right answer is left lateral position. Left lateral position is also known as Sims position, which is favorite position or the appropriate position for administering enema. The next question. A patient diagnosed as multiple sclerosis speaks slowly with long pause between syllables. The patient is most likely in what stage of this disease? Option A, prodromal, option B, early, option C, middle, option D, late. Here the answer for the question is option C, middle. Here the stages of multiple sclerosis are prodromal or early stages before developing classic symptoms. So this is before developing symptom. Middle stage is with the classic symptom. Here the symptoms are already developed. Late stage is with significant disability and impairment. So this is the latest stage. So here he already just started the symptoms like speak slowly with the pauses between syllables. So that is the middle stage where the classic symptoms started. So that's all about the topic. Now we will continue this topic in next part, and thank you all for watching this.